Good morning to you. I'm Teresa Dufour with the CT Style Express report. So while finding a COVID-19 vaccine is on everyone's mind, it's also important not to neglect other necessary vaccines. Joining us today is pediatric faculty and director of nurseries for Middlesex Health, Dr. Cliff O'Callaghan. Doctor, thank you for making time for us today.
Good morning. Lovely to be here.
Yeah, happy to have you here. And today we're talking about vaccines. And I wanted to ask you, what did you see during the pandemic? Were parents still bringing kids in for well visits? Were we keeping up on vaccines?
That was mixed. So many parents were quite concerned. And so they were staying away from everything. They were staying at home and therefore somewhat afraid to come into medical facilities of any kind. And so there were parents who didn't come for their well visits and therefore for the routine immunizations. And then our practices were varied. Some offices really shut down. Others, like ours, continued to offer vaccines through the parking lot. So our nurses were wonderful enough to go out to people's cars and give the children their vaccines in their car seats. And that has been able to keep it up a bit. I think now, with time going by and people still worried, but figuring out how this whole thing goes,
right.
Children are coming back for their well child visits. And therefore, we're catching them up on their vaccinations, which is important for all kinds of reasons, for them personally, but also for the entire community. And flu is a good example, right? If we immunize children against influenza in any one season, it actually decreases the risk to our older population, because children, when they get the flu, they snot everywhere and get everybody sick for a long period of time. And by protecting them, we protect the entire community. And it's the same for the other.
Sure. Doctor, vaccines, it's a hot topic. Some people are all for it, some people are not. What do you say to your patients and their parents that are maybe questioning if they should do it or not? I know it's a personal decision, but I mean, there are medical facts that this is probably a good thing to do.
Absolutely true. It's absolutely clear from a scientific point of view that our world has completely changed in the last 100 years because of immunizations. You and I and our children are safer. We don't have smallpox. This summer, we don't worry about our children getting polio as our grandparents did. I don't worry that much about little children who I release from the nursery out into the world. I don't worry about them getting those childhood diseases that, as a pediatric resident quite a few years ago, I would worry about. It just doesn't happen anymore. So I try to share with them, first of all, I try to listen to why they have hesitancy and address that. Sometimes it takes a while, so I think we really ought to schedule separate visits where we just sit down and invite people to share with us why they are afraid, because that's the crux of the matter. People are sometimes afraid. Sometimes they can express the origin of that fear, and sometimes they can't. And we just hope that if we provide excellent, good care for their children, and they come to trust me, that maybe over time I can convince them that I actually do care for their children. And I would never offer them something that would hurt their child. And that I have given my 3 sons those vaccines also. And maybe over time, they will believe me and do what I feel is right, which is protecting their children, which in turn protects our entire community. So it really starts with listening, caring, and I'm not sure it's convincing, Teresa. It is sharing with them what their personal issues are and hopefully coming to a point where they feel a bit more comfortable.
Sure. I mean, and also taking the advice of a medical professional should play into that, I would assume.
Yes, but there are some families who really don't thoroughly believe in allopathic medicine, and they're coming to me, I realize that, for the WIC forms or the SNAP or their school forms, and they don't particularly believe what I say. But I think over time, hopefully, they can see that I and my colleagues truly care about their children, and maybe they'll listen to something I say.
Well, there you go. I mean, at least you can provide the necessary information. And before we wrap up here, just the best advice for parents as we head back to school. I mean, get those well visits. I mean, for school, you have to have those vaccines.
Yep.
Just getting everybody ready for this new school year.
Oh, we have an hour, right, Teresa?
I know. Just the last 30 seconds, what you could recommend for parents.
Well, it's really kind of thinking about what our bubble is. And when our children do go back, if it's a blended thing, that bubble expands. And if we as parents at home are in contact with older generations, either taking care of our parents, grandparents, or through work, we have to consider that we must really carefully use our masks at all times, as our children must, in order to protect our older generation who are more susceptible. Sure. Because it's fairly rare that little children or healthy adults are going to get really sick. But as more and more people do get it, then that small percentage increases. So wear masks, wash your hands, and be careful as people mix more and this bubble expands,
right,
about our parents and our grandparents and great-grandparents.
It makes a lot of sense. Also, get your vaccines and learn more over at middlesexhealth.org. Dr. O'Callaghan, it was a pleasure chatting with you. Thank you for all the information.
You're welcome, Teresa. Be well. Be well, everyone.